Good afternoon, everybody. Just giving folks another 30 seconds or so to log on before we get started. We have several thousand people registered for today's webinar, so we'll give everybody a little bit of time, and then we'll get started probably at 2:35. All righty, I am going to go ahead and kick us off today. We'll go ahead and get started. I know some folks are still joining the webinar, but we'll go ahead and get started for the sake of time. Thank you all so much for joining us today for the fourth webinar in this series about homelessness and housing first, co-hosted by the National Alliance to End Homelessness, the National Low Income Housing Coalition, and the Center on Budget and Policy Priorities. My name is Olivet, and I am the CEO of the National Alliance to End Homelessness. With me today, alongside our amazing panel, are my co-hosts, Diane Yentl from the National Low Income Housing Coalition and Peggy Bailey from the Center on Budget and Policy Priorities. Before we get started with today's agenda, I wanted to acknowledge that people experiencing homelessness and housing instability, along with our local partners in Florida, are currently in the midst of Hurricane Ian. It's just making landfall right now. And I want to let people know that they're on our collective minds. Here at the Alliance, we'll be amplifying HUD's homeless disaster TA messages on our social media as they're released. And the National Low Income Housing Coalition's Disaster Housing Recovery Coalition will shortly announce weekly meetings to bring together stakeholders and advocates on the ground. All those announcements will be made soon, so stay tuned for folks who are interested in those discussions. As I mentioned, we have about 7,000 people registered for today's session, so we know that this is a relevant and timely topic for so many of you. So I want to go ahead and get started. Over the last 2 months, our 3 organizations have worked together with our national and local partners to produce this series in order to inform the field of homelessness and affordable housing providers about what we see as shifts in public perception and political discourse about the use of evidence-based approaches like Housing First, to talk about the research and the evidence that we have, and to provide our attendees with ideas and tools to address unsheltered homelessness. The first 3 sessions in this series kicked off in August and covered topics like emerging threats facing people experiencing homelessness, homelessness as a housing problem, and long-term solutions and successful strategies. If you missed any of those sessions, we will put the link to where you can watch them in the chat. And this session is being recorded and will also be on that same page so you can access them. I'm also happy to announce that based on the overwhelming response to this initial series, we will be continuing to schedule webinars on this topic monthly starting in December. So stay tuned for the dates of those sessions, as well as the sort of subtopics that we'll be covering from December on into the next year. If you're interested in being a presenter because you have something innovative and that's really working well in your community, or you have a particular challenge in your community that you're working to resolve, please let us know. You can provide us your information in the Q&A box, or you can email any one of us who are on the screen today, and we'll get back to you. Just also want to note that the chat is disabled when we have a large group like this of over 7,000 people possibly attending. The chat is hard to monitor, so we've disabled the chat. But if you have questions, please put them in the Q&A box. We are monitoring the Q&A box. We will answer some questions in the box, and we'll take some questions live for each of our presenters today. So we have a fantastic panel to round out this initial series, and our topic today is how to address unsheltered homelessness. We'll start with a discussion with our partners from CSH, who will specifically address unsheltered homelessness as a public health challenge. And we're happy to be joined by Debbie Thiel, who is the Managing Director of the Western Region CSH, and Dr. Marcella McGuire, Director for Health Systems Integration at CSH. We'll then hear from Jeff Olivet, the Executive Director of the U.S. Interagency Council on Homelessness, who will walk us through USICH's federal guidance on encampments. Then we're going to dig into some emerging threats to our work to end homelessness and how communities can think about addressing those threats. Dr. Bambi Hayes Brown, President and CEO of Georgia ACT, will talk about how they were able to combat dangerous statewide legislative efforts to criminalize people experiencing homelessness. And we'll talk about why that approach, the criminalization approach, is so very harmful. Then we're going to hear from my colleague, Marcella Middleton, the Executive Director of Away Home America, about some of the emerging threats specifically related to youth and young adults experiencing homelessness and housing instability. Then, as we normally do in these sessions, we'll end with how advocates, service providers, and other stakeholders can take action to promote evidence-based policy and program design and educate state and federal decision makers about what's working or not working in your communities. That part of our agenda will be led by my colleague, Sarah Sadian, Senior Vice President of Public Policy and Field Organizing at the National Low Income Housing Coalition. And then lastly, I want to note for our attendees that we'll be sharing a survey after the call today to get feedback on these webinars so that we can improve for the monthly series that we plan to launch in December. And with that, I'm going to turn it over to you, Marcella, to get us started.
All right, thanks, Anne. And thanks to the good people from National Low Income Housing Coalition, the Center on Budget, and NEH for bringing us all together today. I'm going to talk about framing public health challenge, homelessness as a public health challenge, and messages and information that can be helpful to you in that process, new resources that are coming as well. And Debbie Thiel is going to talk about some specific work in the state of Washington that we find really exciting, because I'm going to talk about how important it is to align systems, and Debbie's going to talk to you about how systems are aligning actually in Washington state as we speak. So next slide, please. I love this slide. This slide reminds me of our initial Housing First program that we did in Philadelphia, where I'm coming to you from today. It was run by an agency called Horizon House. We call the program New Keys, and it brings the joy of the keys and those possibilities of thriving and recovery for people receiving assistance in our communities. I've been asked to speak today on unsheltered homelessness as a public health issue. We think about this as new strategies that you can employ, new allies with new resources that you're going to be able to bring together as part of your partnership. Partnerships is just absolutely central to addressing unsheltered homelessness. So yeah, and in the field as it stands today. So next slide, please. I'm going to talk about two complementary fields here. Healthcare is what we all experience. It's our doctors, it's our nurses, it's all those people who care for us when we're sick. As a trained clinician, I know that its models, its ideas, its philosophies at a very fundamental level, they're all very individually based. Here's what happens to a person, here's what a person can do, here's what a person shouldn't do. Public health is really that systemic approach. Public, as is happening and discussing at today's White House Conference on Hunger, public health brings an emphasis on systems. It brings emphasis on access to services and supports. It gets you beyond individual choices to think about systems. Public health brings that perspective to all of our work. It's systems thinking. It's work not just to help an individual, but work to help a whole community stay healthier and safer. Public health has some direct care functions, immunizations, and community health workers, but a lot of public health work is also planning. It is also data, is also systems level work. If you're coming to us from continuum of care and you're going, hey, I do data and systems planning all the time. Exactly. These are some of your new partners that you really want to work with here. I also want to highlight the American Public Health Association has called out racism as a public health issue, because racism isn't an individual issue in our communities. It's a system, it's an institutional, it's a structural issue in our communities, and we have to come to that with systemic approaches. So again, we find new allies in that work. We know that the work to address racism, the work to address unsheltered homelessness, the work to address the lack of housing in our communities needs systemic responses, and systemic responses is exactly where the public health field lives. So I'm going to go to the next slide, and I want to talk to you about some of the things and aspects of the public health field that, again, if like me, you're coming from many, many decades of housing and homelessness work, you're like, hey, this sounds exactly like us too. One, it's driven by values. Both sectors are at their best when they're driven by the fundamental values of equity, health, and wellness and well-being for all. Both sectors of learning in the last couple of decades, public health really forever, but homelessness in the last couple of decades, thank you, Anne, to work at the systems level. For public health, it's their unique role. They're not the hospitals, they're not the clinics, they're the systems people to do a community-based approach. And they're very good at setting the tables and bringing together those partnerships that we need to address unsheltered homelessness in our communities. Both fields right now know that they're not going to be able to move forward unless they center race equity. So much work to be talked about in there. Both fields value no one left behind. If someone is left behind, that means we haven't ended unsheltered homelessness. We haven't kept our communities healthy and safe. So no one left behind is so important. Data-driven and evidence-based approaches, again, essential both to the best work in health and public health work and the best work in homelessness and public health work as well. And two, and I think these are the tensions that we feel in both these fields. One, huge mandate, limited resources. That feels very comfortable and very familiar to all of us in both of these. And we're in an increasingly polarized and politicized environment when you're talking about public health work, whether it's COVID response or other pieces, or whether we're talking about unsheltered. So these are some new allies with a lot of similar values and similar perspectives and similar emphasis that you really want to bring together. So next slide, please. I want to take a minute and breathe and say, hey, what did we learn from COVID? And what are the potential and what new partnerships do we have in space because of what we've done from COVID, what we've learned from COVID? So next slide, please. So COVID has taught us, I can't even say COVID has ended because I hear that's a political term too, and I'm going to step back and stay away from that. But what COVID has taught us and continues to teach us 2.5 years in is a couple of things. One, new networks and new partnerships. If you were in a leadership in a housing or homelessness system role in March, April, May of 20 or 22, my guess is you met a whole bunch of new people who said, we're the public health people to help you with this. If you're the public health people and you're the public health sector, you also maybe at that time met your partners in the housing and homelessness space and began to collaborate in a way that you probably never did before. You lived in what I was always taught to call silos, and those silos need to come together because they're trying to help the same people in a most effective way. So COVID has given us new networks, it's given us new partnerships that we want to capitalize upon. COVID has told us person-centered care. Truly person-centered care will help us achieve our goals. Every time, as somebody who worked many years and led work around unsheltered homelessness, every time we offered somebody an option to come in, but that option was miles away, it was away from where they got their food, it was away from where they connected to people, it didn't feel safe to them. Every time we offered them an option, if they didn't take that option, that's where we have to come up with options. It's on the system's role to come up with options that are truly person-centered. That's a lot of the work that we do in unsheltered homelessness. COVID has taught us that housing first works. How many people did we see come in those early weeks of COVID when we were able to raise up non-congregate shelters? And people just came in droves when they had a place where people felt safe, when they had a place where they could connect to services, where they had a place where they understood where their meals were coming from, where their medications were coming from, where they could get the assistance they need. If COVID taught us anything, it taught us that housing first works, because without housing, connecting to benefits and connecting to healthcare was nearly impossible. Again, it brought us new networks that showed us that we had people who were eligible for many services and supports. They weren't enrolled in them. They weren't set it up. They couldn't navigate those administrative systems. So how important to have housing first so that they can begin that. And I just want to, it's taught us many other lessons, but I've only got a few minutes, so I want to get to you the key info and resources that we want to share with people that I hope will inform your efforts in your communities. So next slide, please. So one, lots of new resources. Our communities are going to be flooded with community health workers thanks to huge new funding through the Centers for Disease Control, through our public health departments, and in particular, the COVID Response and Resilient Communities Act and work. Let me say that these folks' first, second, and third jobs is going to be COVID response, it's going to be vaccines, it's going to be testing, it's going to be helping people quarantine. But maybe job 4, maybe job 5, maybe job 6 is something that it can help us in our work around unsheltered? How do we partner? How do we bring those people for that COVID response out to encampments? How do we bring those resources all together? Think about who's receiving this new funding in your community. Right now, this is, I believe, over the summer that public health departments at the state level, at the county and local and regional levels were applying for this funding. It's about 3.9 billion total. Most of this will be coming to communities in the next year or so. So again, widely new COVID response resources. How do you begin to partner with them? And help them understand healthy communities, which is their objective, is communities where no one is experiencing homelessness and particularly no one is unsheltered. So figure out who's receiving this funding in your community and how you can partner with them to achieve their efforts and yours. Next slide, please. So I'd be remiss as somebody from Corporation for Supportive Housing, and I can talk about how communities are expanding supportive housing in our communities. They're using Home American Rescue Plan money. Thank you for all the advocates here who made that happen. They're also looking at strategies about how to use the federal Medicaid or healthcare coverage program in order to fund supportive housing services. If your state's in purple on this map, purple's my favorite color, that's why I chose that one, then your state somewhere is offering Medicaid supportive housing services funded by Medicaid. So there's the ability for expansion of supportive housing services and aligning those systems. This differs state by state, but our map and our policy brief, which is linked here, will also give you more details on that. You'll have my contact info at the end if you've got a question about your state. Literally my favorite topic, please be in touch. So states are expanding supportive housing community by using Medicaid to cover supportive housing services. Next slide, please. And so what are we learning from states? Washington State, Hawaii, these are some of the earliest states that have done this work, states with huge homelessness challenges. What are the best practices we're learning from states? Well, one, we're learning the agencies on the ground, the housing and homeless service agencies, they need startup funds, they need capacity building funds like Minnesota and North Dakota are offering to their housing supportive services providers. You need to have a billing system. You need to have new understandings of the administrative structures. If you're coming from the housing and homelessness world, your administrative structures are geared towards HUD. This is a totally different process. We're learning that Medicaid covers most, but not all of the services. We're going to need graded funding guidance on that. We're learning that it doesn't matter if you have services if you can't access housing. So how are the housing resources in your community aligned? Debbie's going to talk about Washington State and how they're doing this, but a shout out to Washington, D.C. and New Hampshire. They're integrating their Medicaid services, Medicaid supportive housing services into their coordinated entry systems so that the burden on negotiating, combining these services doesn't fall on the person as it most commonly does, doesn't even fall on the provider, but it's integrated in at the systems level. So important to the work we do. Shout out to Washington State again, they're doing a third-party administrator model. Medicaid is complicated, managed care makes it even more complicated. So they are making it as simple as possible in Washington State by having one Medicaid agency statewide that is offering the Medicaid services benefit and making sure that they know that a lot of their role as a third-party administrator is also to bring in other housing and homelessness agencies that haven't done Medicaid before, but know how to line up housing resources, know how to work with these folks, know how to address unsheltered homelessness. And again, a huge shout out again to Washington, D.C. and Rhode Island. They're making Medicaid financing as simple as possible. They're using what's called a per member per month payment mechanism. You see someone a certain amount of time, you submit one single claim, you get paid a monthly rate. So much easier than what you more commonly see in healthcare, which is 15-minute increments and or even a per diem. So shout out to that. This is where the best practices are, where we're seeing at the structural and system level, because that's what public health thinks about, and that's how public health thinks about these things. So next slide, please. And then from an advocacy perspective, CSH wants to raise up our Supportive Services Transformation Fund proposal. This is really 3 buckets of funding we're looking for at the federal level. 1 is having your state do the Medicaid related services, but 2 is those other pieces we talked about. The pieces where agencies need startup fund, they need Medicaid is a prospective payment system. You do the work, then you get paid. Agencies are used to mainly a retrospective payment system. You write the grant, you then you get paid, then you do the work. Your agencies don't have the margins they need in order to get through that process. So they need startup fund, they need training, they need technical assistance, they need money to buy a billing system. And then finally, though I hope Arizona may prove me wrong, a lot of the work that we do is not able to be covered. Work in supportive housing is not able to be covered by Medicaid. Arizona's made a proposal to use Medicaid to fund street outreach services. We hope to hear from that in the next couple of weeks from them. But that's just some of the working with people who are not Medicaid enrolled, getting them on benefits. These are some of the things that Medicaid just can't pay for. In order to really link all these pieces together, you need that assistance as well. So this is a link, and click on to learn more about CSH's Supportive Services Transformation Fund proposal. Next slide, please. If you have any other questions, my email, my Twitter handle, more from there. But I'm going to turn it back to Anne, I believe, for any questions before we go to Debbie and Apple Health and Home.
Great, thank you so much, Marcella. Actually, I'm going to go ahead and turn it over to Debbie first, and then we'll do your and Debbie's questions together, if that's okay. Debbie, are you with us? Outstanding.
I definitely am. Thank you, Anne and Marcella, and thanks so much to the National Low Income Housing Coalition for having CSH on today to talk about pairing services and housing in what I would say is a more robust way than we have really ever been able to do before. And we're all up against a lot out there, but with some strategic work together on the part of folks like you and our elected champions, we can combat this negativity and get our communities refocused on solutions. So I'm going to build off of what Marcella shared about bringing Medicaid to the table to pay for tenancy support services, and talk about legislation that was recently passed in the state of Washington that intrinsically links our Medicaid tenancy supports benefit with housing. So we at CSH see this as groundbreaking legislation because it directly counters the dehumanizing policies that we see promoted by groups like Cicero, which you'll hear more about later in the webinar. And I'm going to walk you through the key aspects of the legislation, but I first want to mention that you do not have to be an expansion state to do this, nor do you really even have to have a Medicaid benefit for your tenancy support services. Of course, that makes your services revenue much more robust and helps to really distinguish who needs and will benefit from supportive housing. But this is possible to do in a lot of different states and counties and local jurisdictions. So in Washington, we are integrating Medicaid services, but we're also looking now at our flexible services dollars that come out of state general funds and document recording fees that pay for housing and services, and aligning all of those resources and integrating them for one clear path toward investing in supportive housing and really measuring outcomes. So the other thing to know, as I mentioned, is that this we're talking about state legislation here, but I don't see any reason why we couldn't replicate this at the local level. So wherever you have the building blocks of operating funds or rental assistance and services, you can replicate this concept. And if you add capital to the mix, then you've really got the gold standard. So the legislation is called the Apple Health and Homes Act. Why Apple, you might ask? We're from Washington State, Washington Apples. And so that's actually the name of our state Medicaid program, Apple Health. And we have a lawmaker here, Representative Chop, who was our Speaker of the House for 20 years and had a vision for integrating healthcare and housing for people experiencing chronic homelessness and unnecessary institutionalization. And he said, and started bringing lots of people together to ask a question around this. He said, if someone needs a home in order to be healthy, then shouldn't we be providing them both a home and healthcare? And it's just such a logical concept that we've really started to see support very early on from folks all across the state, from providers and funders and lawmakers and across the aisle. So when you talk about having a champion in the legislature, this is someone, Representative Chop, who has consistently supported legislation on affordable housing and wanted to take that to the next level. And I want to just take a moment to give a shout out to the Washington Low Income Housing Alliance and Action Fund, because they have literally worked for years and years to build legislative understanding and support for supportive housing. And that was the groundwork that laid a foundation for this kind of legislation. As well, another representative here, Representative Macri, who also works for a supportive housing agency, DESC, was an incredible champion and support to working out many of the logistics that we had to sift through and actually getting this legislation ironed out. So the Apple Health and Homes Act passed the House by 96-2. And I'm so excited about that because it says, again, that pairing healthcare and housing just makes sense. And this isn't a partisan issue. This is something that really is solution oriented and makes sense to everybody, regardless of political affiliation. So what does it do? Finally get to the punchline here. Okay, so 3 things I want to cover that it does that I believe are transferable to just about any investments you're making in supportive housing, and then 2 that are a little bit more Medicaid specific. One is it intrinsically aligns our investments in housing and services so that we have consistency and standards across state investments in supportive housing. You know, most of the time we see these kind of siloed funds of capital, operating, and services, sometimes focusing on different populations, sometimes different services. But in this case, we are saying the state has worked really hard to come up with very clear eligibility criteria for supportive housing. That eligibility criteria is quite robust and comprehensive. So we're not only addressing chronic homelessness, we really are looking upstream at the needs of people who are unnecessarily living in institutions and or cycling in and out of institutions and experiences of homelessness. So by establishing robust criteria originally in our Medicaid program and now applying it to all of our housing investments in supportive housing, we can be sure that that front door is really clearly inviting in the people who have the most significant needs and who are clearly the folks that can benefit from supportive housing. So one set of comprehensive, extensive supportive housing eligibility criteria. Doing this will also allow us to track outcomes. So we know who we're serving, what their needs are, and we can start to see what our investments are actually producing in terms of housing and services. And we can prove over and over again that supportive housing does work and add to that research and evidence base. So the second thing is that this legislation creates new funding and an account in the state budget for investments in supportive housing. And this was a really strategic move, I think, on the part of the lawmakers involved, because this said that we're not just kind of borrowing from other funds, and we're also distinguishing, again, supportive housing as a unique subset of other affordable housing investments. So this particular legislation was accompanied by a budget contribution of $60 million in capital. And then it also dedicates a portion of our existing operating funds into that same account. So again, streamlining, standardizing our investments for clarity for our funders, our providers, and the general public about where those public dollars are going. The third really important aspect of this legislation is that it creates oversight and accountability. So that starts by creating an Office of Health and Homes, which is located in our Department of Commerce and is part of the housing division within that state office. That office was supposed to be up and running by January, but they've already hired Director Melody Pazalt and are off and running. Another thing that the accountability does is it requires at least 10% of investments to go to organizations led by Black, Indigenous, and other people of color and other by and for organizations. So we were really pleased to see the legislation carrying some racial equity provisions that will help to ensure that if we're going to start doing things differently, that we also make sure we're doing everything in a racially equitable way. And there's some advocacy now to increase that percentage. It will require this office, which is in the housing department, to work with the healthcare authority which oversees our Medicaid benefit, to measure those outcomes consistently and to disaggregate those outcomes by race so that course corrections can be made quickly and swiftly to make sure that outcomes are racially equitable. There's a separate piece of legislation that creates a supportive housing oversight committee, which we're really excited about as well. That's going to help make sure that we do this work in a way that is informed by others across the state. And then two specific Medicaid pieces. One I'm particularly excited about is a budget contribution for creating capacity building for providers to bill Medicaid. And I think if that's anything I've learned in doing this Medicaid tenancy supports over the years, that's one of the biggest things, is that we have to invest in our provider community to start making this shift from what are flexible but limited and constrained dollars at the local and state level into a healthcare arena. So really robust provider-centered capacity building. As well, it commits the state to providing those tenancy support services regardless of the status of our agreement with the Centers for Medicaid, Medicare, and Medicaid Services. So that's a really big statement from the legislature that we're going to be investing in capital, operating, and services in a streamlined, efficient way. CSH is developing a toolkit for folks who want to work with their electeds on similar legislation. We really think these are the building blocks that we all need and can be replicated in a number of jurisdictions. We look forward to working with all of you and pushing legislation similar to this that counters the negative message and is solution-oriented and person-centered. Thank you.
Thank you so much, Debbie and Marcella. Marcella, if you want to come back on screen for a quick second, we have a couple of questions for you all in the Q&A. The first is there's a number of questions about this, like where does housing come from in this in different states? So can you talk a little bit about clarify whether Medicaid funds can be used for housing? And how housing and sort of healthcare systems are working together. Like, what are good examples of those folks working together?
Sure. There's a couple of different kind of examples, I will say. First off, the wall that says no, Medicaid can't pay for housing is kind of starting to crumble a little bit. It's important to remember that Medicaid is a state-specific program. Anytime anybody asks me a question about Medicaid, my first question is, what state are you from? So I'm going to give you some specific state examples that are exclusive. One, in a certain sense, Medicaid's already paid for housing because nursing homes are housing. And people live in nursing homes for long periods of time, and Medicaid's already paid for nursing homes. What we are starting to see is states requesting through their research and demonstration what are called 1115 waivers, approvals for states. So I saw a couple questions about California. California's 1115 Medicaid waiver approves their managed care companies, if the managed care companies choose to offer medical respite, or what they call recuperative care in California, what the homeless world would call medical respite. They approve post-hospitalization housing for 6 months. And that's really our question, is where is this going to connect to the affordable, to the supportive housing, to the homelessness system world? Because 6 months, people need housing for longer than 6 months. If you're ill enough to qualify for these programs, you're probably not going to be getting market rate housing on your 7th month, et cetera. So there is some state pushing in that direction. But it's also, and it's really the devil's in the details of where it's going to happen and where it's going to be available. But CSH is watching this closely, and we'll lift that up. And maybe another aspect to your question I didn't answer.
Well, I think that folks could also go to the CSH website. There's a whole bunch of resources available for folks.
True. I know your other question was sort of where are, so health and housing. So there's a lot of details. There's a lot of different kind of projects. So for example, right now you will see big for-profit health companies like United, like Anthem, like Centene making investments. They are making investments most commonly in low-income housing tax credits because that makes sense for them financially, and that keeps our capital market strong in regard to low-income housing. You see smaller examples of, I think about CareSource in Ohio, Ohio that does grants to agencies or low interest loans. I think about other options in places where they're making investments, but it's also really important to look at the structures and see what the incentives are. If I'm a large for-profit company, I'm incentivized to, it makes financial sense for me to do tax credits. If I'm a big hospital that has a requirement for community benefits in a Medicaid expansion state, I commonly may be investing in health and housing in some way. These are the partners and the networks that you want to build, and you want to make sure that it fits with the strategic priorities of your community and the needs of the folks there. But you also, it's important to keep advocating for those potentials, like Debbie talked about in Apple Health and Home, where you bring those systems together and where those big systems have the financial incentives to collaborate. So lots of work happening on a lot of different ways. Some of it, most of it happening small, but growing potential for scale. And when I say small, I mean pilots.
Yep. Thanks, Marcella. That's actually a great segue into my second question for you all. And Debbie, you indicated, this is coming from Alex Lett. You indicated that Apple Health and Homes is something that can be done at the local level. Can you expand on that a little bit more? Because we know that money is coming through Medicaid, and how does that apply at the local level?
Sure. What I was suggesting there is that the work of the Apple Health and Homes legislation is at its core about aligning all of our investments that are geared towards supportive housing to supportive housing. So instead of providers having to go after this pot and that pot and trying to figure out how to meld them together, this is being done at the system level by having consistent eligibility criteria across all of those resources. So if you're at the local level, you may not be using Medicaid, but you might have some other services resources. You might have PHA, Public Housing Agency preferences that you could align. You could have other capital investments that are passed through from home or CDBG. So it's really about looking at the eligibility criteria and the services package and lining them up for your supportive housing investments.
That makes a lot of sense. Thank you so much to both of you for this incredible presentation. And if you have time to hang around, we might have more questions at the end. But for right now, I'm going to move us on to our next speaker. Jeff Olivet is the Executive Director of the U.S. Interagency Council on Homelessness and a close partner to us at the Alliance. Jeff, you have the floor.
Thank you, Anne. It's really great to be with you all. And Anne and the Alliance, the National Low-Income Housing Coalition, and the Center for Budget and Policy Priorities. I think it's just fantastic that you all are holding this series and that there's been such incredible interest in the topics around housing first and related issues. I'd like to just start, May. I think we've got some slides that I'm going to be going through too. I'm going to share with you some of the work we're doing within the Biden-Harris administration on unsheltered homelessness in particular. And we know that this is part of a much larger set of priorities we need to wrestle with as a nation around homelessness. We know it's not the only dimension of homelessness, but it is one that is critical because it is a life and death public health crisis for people who are living in encampments, living on the street, living in their vehicles. Within the administration, we're doing a number of things, and I'll share with you some of the principles that we've put out around addressing encampments. But I also wanted to say that we're not just putting out guidance and words and ideas, we're putting money behind it too. Many of you saw earlier this summer that HUD released a new notice of funding opportunity around unsheltered homelessness. This brings $465 million to the table around unsheltered and rural homelessness, as well as support for housing vouchers. We also convened a working group of federal and national partners on unsheltered homelessness. And out of that group came a set of 7 principles for addressing encampments. And that's what I'll go through here for the next few minutes. Communities are under immense pressure to do something. You know, people are seeing encampments pop up all over, not just in large cities on the West Coast, but all over the country, and often in communities that have not seen large-scale encampments before. And you know, we recognize that there's a public outrage around this. We recognize that politicians, elected officials are under immense pressure to do something. And in the worst cases, we see police sweeps with no plan for housing and services. In the best cases, we see a coming together of communities around real solutions and a more thoughtful, methodical approach to addressing encampments. Our basic position at USICH is this: it is not okay that we have encampments in American cities, but it is first and foremost not okay for the folks who are living without homes. And this is a human issue. It's not, it certainly has public health dimensions, public safety dimensions, but this is really about human lives. And that we also know that the solution to homelessness is housing and services. I'd like to say unequivocally that the Biden-Harris administration supports housing first and sees housing first as the way out of the crisis that we're in now. It's got to be paired with robust services. Housing first does not mean housing only. It's also got to be paired with upstream prevention so that we turn off the faucet of folks coming into homelessness to begin with. Back to these principles. The guidance that we're providing when we meet with mayors, when we work with communities, is to address encampments. Don't just let the status quo be, but to do it in a thoughtful, methodical, solutions-oriented way. And the 7 principles we lay out here, we believe, create a package for doing that. Next slide. The first principle is to establish a cross-agency, multi-sector response. We know that homelessness is a multi-systems failure, and that we need to have multi-system solutions. That means bringing all kinds of partners to the table, where it's the nonprofit services sector, housing providers, the faith community, healthcare systems, public health, city and county departments, as well as people with lived experience. The approaches that we see working are when there is very regular meeting and coordination. In many communities, these groups meet daily. And it's, Anne mentioned our friends and colleagues in Florida right now bracing for Hurricane Ian. We know that command and control centers work well in the wake of a disaster. We're in the middle of a disaster right now on unsheltered homelessness. So that same kind of urgency and coordination and bringing people to the table daily is really effective and useful. We know that police and sheriff's departments play a role in addressing unsheltered homelessness and encampments. We also believe that these approaches should not be driven by law enforcement. We've seen communities where the police are essentially just sweeping out encampments and people's belongings are being destroyed. That doesn't work. It's not effective. It's not humane. But we also know that law enforcement is often on the front line of interactions with all kinds of people, with neighbors, with folks who are homeless, with who are experiencing homelessness, with business leaders. And so we're recommending that law enforcement has a seat at the table, but that these approaches are really driven by public health. Next slide. We also know that the best solutions come when you bring folks to the table who are closest to the problem. Brian Stevenson at Equal Justice Institute talks about being proximate to the problem. And people experiencing homelessness are most proximate to the problem. And as we know, people of color are dramatically overrepresented among those experiencing homelessness. So we need to make sure that folks who are living in the encampments, folks who have experienced unsheltered homelessness, are at the table and creating the solutions in a real power sharing kind of way. We're trying to do that at the federal level. We want you all to be doing that at the state and local level as well. Next slide. I'm a former outreach worker, and I hope there's some outreach workers or agency folks on this call who really support outreach and do outreach. I was just in San Diego recently, and encampments are a real problem there, and there's been a lot of tension around the law enforcement response. What I also saw in San Diego across the county was a very robust outreach approach where the outreach teams were going out daily and all hours of the day into communities. And that's what we want to see. What I've seen in Houston is a real patience with that outreach. So the outreach doesn't come immediately before police sweep in and move an encampment. There are often weeks of connection with people and connection to housing, really housing focused outreach in a way that that creates a pathway and the trusting relationship that allows people to move from an encampment into a new home. We see in that case really good data sharing across systems where you've got more mental health involvement and more hospital involvement and real coordination around that. We've seen a number of communities literally, map and color code and rank order what their encampment landscape looks like, so they can be more thoughtful and methodical about how they can work with the outreach infrastructure to connect with people and connect them to housing. Next slide. The next principle is to provide for basic needs and storage. And this is true prior to addressing an encampment and in the moment of people moving out of an encampment. We've seen in too many cases, people's belongings, including medications, prescription eyeglasses, identification papers, just swept away and destroyed, thrown into a dumpster and driven off. And that can set back the process of getting into housing, of maintaining healthcare and wellness. It can set that back months, even years in some cases. So we want to make sure that people's belongings are protected in this whole effort to address encampments. We've seen very effective storage models where people have free storage for their belongings and can go to those facilities and get what they need. We've seen other communities really attend to the kind of cleanliness and garbage pickups and shower and hand washing and bathroom needs that people have, even while an encampment is in use. And I know this is it's a tense one for communities because they're often reticent to put too much money and too much perceived permanence into the kind of public health and cleanliness side of this. But what we know is that as long as an encampment's there, the people who are living there need to go to the bathroom and they need to wash their hands and they need to be able to attend to their basic hygiene and have a clean place to stay. So it's important that Public Works is involved, looking at garbage pickup and sharps containers and ongoing maintenance and that sort of thing. And then certainly after an encampment is resolved, the kind of cleaning up of that space and repurposing it, which I'll talk about in a minute. Next slide. This is probably the most important one. It's got to be related to housing and services. You got to get people into housing. That is what is ultimately going to solve unsheltered homelessness. We know that in the meantime, many communities don't have enough housing. It's sometimes a supply problem, sometimes a cost problem. Vacancy rates in many communities are in the single digits and even lower than 1 or 2% in many places. The housing costs are shooting through the roof. Often people have a voucher and they can't even find a landlord to take it in many communities. So we know there are a lot of barriers to housing, and we've got a number of strategies on that front as well. In the meantime, we hope that communities will attend to the immediate shelter needs of the folks who are experiencing unsheltered homelessness. And there's a lot to be learned from our COVID response in this. I think the master leasing of hotels and motels for non-congregate shelters was an incredibly effective approach. We're also seeing a lot more emphasis on harm reduction shelters, people being able to access them with very few unnecessary programmatic requirements. This is a place to keep people alive so that we can figure out the pathway into housing. Next slide. The permanency is what's going to make this work, and connecting people to housing first or as quickly as possible, if housing is not immediately available, has to also involve the wraparound supports. And I was glad the team from CSH talked about all of the financing mechanisms, particularly on the Medicaid side, for really sustainable services and supports. And this is one real concern I have, is that as we scale up access to housing through vouchers, through home ARP funds and other resources, we've also got to scale up the services side, or for many people, the housing's not going to stick. I said earlier that housing first does not mean housing only. We need very good and robust wraparound supports. Next slide. And the last principle is, what do you do when an encampment's gone? How do you create a space that works well for everyone? And that's not through ongoing criminalization of folks who are homeless. It's not through punitive architecture that tries to make it uncomfortable or impossible for people to be there. We want to see vibrant public spaces that work for everyone. Last slide. just a couple of things about connecting with us. If you're not already connected with your senior regional advisor, we have a team of folks who cover the entire nation. That's on our website at usich.gov. Get on our newsletter. You can find more detail on these principles on our website. And Anne, I will kick it back to you. And I don't know what our time's like. I'm happy to answer questions if there's time, or if we need to move on, I get that too.
Yeah, no, I'd love to ask you a couple of questions. There's some questions for you in the Q&A box. The first one is about who has leverage in the community with respect to housing people who are unsheltered or who are otherwise vulnerable. Is it the mayor? Is it the city council, the housing authority? Where would you suggest somebody get started with this work?
It's all of the above and then some. I think where we're seeing progress, and what I mean is literally moving the needle on numbers of people who are homeless, numbers of people experiencing unsheltered homelessness, encampment resolutions into housing. Where we see that happening well, it appears to me that it's when everybody's working together. And when I say everybody, I mean mayor, city council, city public housing authority, county public housing authority, the COC, the nonprofit providers, lived experience advisory groups, youth action boards, but also downtown businesses and downtown business improvement districts and police chiefs who are interested in the solutions, not just in sweeping away the problem. The faith community in some communities is really focused on the shelter side of things so that public dollars can go much more towards housing and services. When those groups are all aligned with a goal and a vision and good communication and reasonable trust, it's not always going to be perfect, but when they're aligned, good things happen. When they're not aligned, there's just a bunch of blaming and finger pointing, and the needle moves the other direction. And so I think, when you ask the question about who has leverage, every one of those folks you mentioned, and some of the others that I mentioned, have a role to play in this. And it really is about getting around the same table, finding common ground around the goal, which is none of us want to see unsheltered homelessness in our communities, but let's get to an end to that through housing and supports, not through handcuffs and citations.
That's awesome. Thank you so much, Jeff. I'll ask you one more quick question, and then we'll move on to the sort of emerging threats part of our agenda. And that is that there's been a lot of really negative rhetoric lately about, I referred to this a little bit in my opening, around people who are unhoused, who are living unsheltered. And can you talk a little bit about the administration's approach to maybe changing that rhetoric or addressing some of that really negative stereotypes?
It's a really tough one, and I look forward to hearing from Bambi and Marcella in a little while just about the threats, because it's very real. The vitriol, the anger, the hatred, the dehumanizing language we hear is very real. And this is going to sound, I don't know, this may land with some as lofty and vague, but I'm going to say it anyway. You fight hatred with love. You fight dehumanization with humanity. You try to get people talking to one another, and in particular, talking to people who are homeless as human beings, and not just as human beings, but as full and equal human beings. And so what we're trying to do is to create different kinds of tables. We're also trying to have very concrete conversations with mayors and city councils and those in positions of elected authority to say, these are human beings we're talking about. Let's not play political games here, like we're seeing with some of the asylum seekers these days being thrown onto airplanes and buses and taken to who knows where, other cities. Let's stop playing games with people's lives. Let's remember the humanity of folks we're talking about. And I think we're just trying to stay relentlessly focused on the humanity of folks who are experiencing homelessness, but also to try to tap into the better angels of the neighbors and the businesses who are understandably frustrated. Like, I get why they're upset that this problem is not going away, but you don't make it go away by hiding it. You make it go away by solving it. And that's the conversation we're trying to have.
Thanks so much, Jeff. That was really helpful. I think we're gonna shift a little bit in the conversation. We're gonna talk about some of the emerging threats. And next up, we have Dr. Bambi Hayes-Brown, again from Georgia ACT president, who's going to talk about what's happening in Georgia. Bambi?
Yes, good afternoon or good day to everyone. And thank you so much. It is a pleasure to be here. It's going to be hard to follow up with the previous panelists. They did an excellent job. But I'm going to talk about some things that we are seeing here in Georgia. There was a legislator on the House side in the Georgia General Assembly that was from North Georgia and came to her sessions as they do from January to March or so every year. And she ran into people who were unsheltered. And she stated that she wanted to do something about the unsheltered and being out there, especially around the Georgia state capitol. And then a bill was introduced on the House side and then on the Senate side. So we kind of got it from both directions. On the Senate side, we also had a legislator from South Georgia who was out running and saw the number of unsheltered brothers and sisters that were on the street. And so there were two bills that were introduced on the House side and the Senate side to quote unquote address unsheltered homelessness using the Cicero bill. And the Cicero bill has been enacted in other states around the nation that would criminalize homelessness and will also take away much needed funding for those municipalities or those nonprofits or cities, counties that were not able to reduce homelessness. And as we already know, as a person with lived experience of homelessness, homelessness is multifaceted. There are multiple reasons why a person is homeless. So again, kind of piggybacking on what Jeff said, we need to get out of the politics and look at the humans and look at that this is a human issue. This is a morality issue. This is a people issue. Regardless of their circumstance, they should be treated with dignity. And I will unequivocally say that jail is not a substitute for housing. And so that was one of the key things that we saw in the bill that really got people's radars, and really got people up and running to say that we need to stop this because we do not want our jails to be used as housing. And we do know that in some cities around Georgia, that has happened. And that is some of the arguments that those who are pro this type of legislation have experienced or have made those talking points. So we were very strategic in getting all of our coalition with Georgia Act, with our partners, the Continuums of Care, the Georgia Supportive Housing Services, as well as our grassroots organizations to come together and say that we do not want this bill. This bill would not help our unsheltered brothers and sisters because we already have a significant lack of funding for supportive housing and those wraparound services that are so important. And as someone with that lived experience of homelessness and with the lived experience of running the HUD VASH program, which sought to get homeless veterans into permanent housing with those supportive and with those wraparound services, we know that we need more money and more resources around that. So we were able to get people from across the state, even though it started primarily with an Atlanta issue, we were able to say, hey, this is not just an Atlanta issue, this is a Georgia issue. This is happening in suburban communities with homelessness. This is also happening in our rural communities, especially with our people and partners in Valdosta, Georgia, the South Georgia Partnership to End Homelessness. They were constantly working with families trying to get them sheltered. And there was one lady that they gave us the narrative about who was in a encampment under the tree. And if you know, Valdosta is very close to Florida, face a lot of the tropical weather that we're seeing right now coming headed our way. The tree limb fell on the lady and she passed. And so that is something that really, I think, really really got to the heartstrings of legislators, as well as people around the state. We even saw where people in Albany, Georgia, wrote op-eds and opinions about the Cicero bill. So we were able to stop the bill, but what happened was there was a Georgia State Senate committee that was formed for unsheltered homelessness. And there has been one hearing for unsheltered homelessness, and there plans to be another hearing for unsheltered homelessness. So we had many, many experts. I think the testimony lasted around 8 hours or more for people to speak. Georgia Act, we spoke, legislative analysts, many of our partners around the state came and spoke about how this bill would be harmful, including those mayors and our direct service providers. And we did have a voice from some that had lived the experience of unsheltered homelessness, but that is something I would definitely say that we need more of. We need to put those who are closest to the problem at the forefront. And when we look at the tactics that the Cicero Institute used, we want it to be clear. We reiterated this over and over again that we were not going to stand for criminalizing the homeless. But we do understand, and we have already heard that they do plan to try to move this bill or some variation of this bill in the 2023 legislative session. And I cannot underestimate the importance of building relationships with your elected officials on the federal, state, and local level. Advocacy is 365, 24/7 is the analogy that I always use. So don't wait until your General Assembly is coming up, or don't wait until you get a bill and you try to react. We want to be proactive to talk about the support of housing, to talk about housing first, to talk about those wraparound services and those things that are needed to hopefully end homelessness, because that should be all of our goals, as Jeff stated, is to end homelessness, because homelessness affects children, youth, disproportionately Black and brown people. So we have to be very vigilant with that, with building those relationships. Again, not waiting until the Georgia General Assembly to do so. Even in your conservative states, because legislators, they have to answer to the people. They have to answer to their constituents. And so that's why the coalition building is so important, and hearing from those individuals with that lived experience. Because if you criminalize homelessness, now you're going to create a problem in the jails with overcrowding in our penal system, and no one should want that. We also have to look at inverting the burden. So having those low barrier shelter options and those low barrier housing solutions for people. And then I know in Atlanta, there has been a lot of encampments that have been raised, and people have lost their birth certificates, their IDs, their medications. So we don't want to set people back, even with our partners. And I think that's something that we also cannot underestimate. Even with our partners and our allies, even though well-intended, sometimes some of the practices that they use can also be harmful. So we have to look at not narrowing the table where we have just a few organizations controlling all the resources and all of the funding. We have to widen the table, because there are several nonprofits that are doing that on-the-ground work who only need just a little bit of funding to help the constituents, our unsheltered brothers and sisters, such as the beloved Community Development Corporation in the Pittsburgh community of Southwest Atlanta, who has respite services, who has those services where people can go in and get showers, and they help people with food and also with applying for those services that is very much needed, that they may be eligible for. So albeit Medicaid, food stamps, Social Security, all of those things. And then also Again, we have to look at people like Erica Wright, who has been going out in her vehicle and engaging and feeding and providing hygiene kits for our unsheltered brothers and sisters. And something that was very, very beneficial to us was something that we mentioned at the hearing was the documentary by Coletta Harris, No Address Atlanta. She also has a No Address documentary at Columbia, South Carolina. And it talks about both the South Carolina and the Georgia docuseries talks about the issues that our unsheltered brothers and sisters and the barriers that they have faced with trying to assess services and trying to assess housing. And so giving a critical and honest look at our system, at our services, so that we can better work together so that people like the Cicero Institute and the legislators won't have a leg to stand on when it comes to trying to criminalize homelessness, because that is not what we want to do. And if someone has a record, we know that even with trying to get into housing down the road, I'm a former property manager. If they have a record, then that can affect their ability to find housing. So all of those things have a long-lasting effect on our unsheltered brothers and sisters. So again, we need more resources and more funding, and we need to uplift the voice of those with lived experience, and then we have to continue to engage our legislators 365, 24/7. And I'll be glad to answer any questions you may have.
Fantastic. Thank you, Dr. Hayes Brown. I wanted to note that we have a question in the Q&A that first thanks you for your deep humanity and compassion, but asks and also asks the question about like how might we grow larger and more powerful as a local community to beat back those leading with hate. Could the local NAACP chapter be mobilized? What about faith community leaders? And specifically, how has Senator Warnock used his voice in your state? So that was a multi-pronged question, but would love your thoughts.
Yes, thank you. And I am a member of the NAACP DeKalb and serve on the executive committee. And again, it goes back to doing community mapping and assessing the assets that we already have in the community. Nearly all NAACP branches have housing committees, and I serve on the housing committee for the NAACP DeKalb, and they work very closely with our local elected officials. So we have to think outside of the box. We also have the Housing Justice League, who has created a Georgians for All coalition to promote more tenants' rights. So again, not looking over those organizations, but really doing community mapping to see who is out there, who's doing what, and how we can align those services. And also Senator Warnock has also developed a housing plan that he would like to see in action, as well as several of our elected officials our people who are running for office have also done the same. So we have to continue our civic engagement, making sure that housing is at the forefront. We know we have a lot of competing priorities that are going on, but we have to be vigilant in making sure that housing is at the forefront and affordable housing for everybody in order to solve this issue with unsheltered housing, homelessness. Yeah.
Great. Thank you so much for that answer. And then real quick, before I turn to our last speaker, the name of the documentary that you mentioned, lots of folks in the chat apparently, or in the Q&A wanna watch it. What was the name of it again?
Yes, it's called No Address. And it really highlights things that are going on around the nation, even though it specifically looks at Columbia, South Carolina, and Atlanta, Georgia. But if you just Google No Address by Coletta Harris, then you will see that documentary. And it is a small fee, but like I said in the hearing, that was the best $14 that I have ever spent, because it does highlight those individuals with lived experience, and giving those who traditionally don't have a voice, because we even with us advocates, we will pay high dollars for consultants, but the people who are closest to the problem have the expertise to solve that problem. And our experience and our knowledge and our expertise with those who have lived experience is just as valuable as those consultants, legislators, and researchers. So we also need to be compensated. So we have to be careful that we do not sharecrop the knowledge and solutions of those with lived experience, but we are paying those consultants to say the things that we have already been saying all along, kicking and screaming.
That's right. Thank you so much. My 3 takeaways from what you just told us: community mapping is incredibly important, continuing to deepen your civic engagement, and real partnership and thought partnership, and work with people who are closest to the problems that we're trying to solve. Thank you so much, Dr.
Thank you.
Really appreciate it. And now I'm going to turn it over to my colleague, Marcella Middleton, who is the Executive Director of Away Home America. Marcella and I get to spend a lot of time together every week in various meetings, and I'm just so pleased that you could join us today. Marcella, I'll turn it over to you.
Thank you so much, Anne. I appreciate that. And thank you so much to all the previous panelists. Dr. Hayes Brown, oh, you said a word, spoke a word. The whole time I was just back here just like, yes. But as Anne mentioned, my name is Marcella Middleton, and I'm the Executive Director of Away Home America. What's unique about this organization and my role at Away Home America is that we've shifted power to young people with lived expertise by having 51% plus young people with lived expertise as our leadership body, which is the equivalent of a board of trustees, as well as my role, which I bring my lived expertise and other professional knowledge. Away Home America is ending homelessness for Black, Indigenous, youth of color, and LGBTQ plus youth on a path of ending it for all. Today, I would like to address how important Housing First is to Away Home America's overall mission and the criminalization efforts impacting young people experiencing homelessness. And while I won't be able to address all the needs that we need to attend to in working to end youth homelessness, I invite you all to join us in the fight to end the plague of homelessness. I am trying to move this. Thank you. And can you go to the second one, please? All righty. So I want to talk a little bit about Away Home America's New Deal to End Youth Homelessness and its connection to the Housing First approach. The New Deal is Away Home America's comprehensive policy proposal. It's a roadmap to transform how youth and young adults, particularly Black, Indigenous, and LGBTQ plus youth, are supported in our society. It's a transformative vision grounded in equity and defined by young people, and it builds on the hard-fought efforts already underway and reorients them around justice for youth and young adults. Our New Deal has 5 pillars, which is the housing justice pillar, the child and family well-being justice pillar, the transformative justice pillar, and the economic justice pillar, to include education, because you can't have economic justice without educational justice, and the immigration justice pillar. At the conclusion of my presentation, I will make sure that you all have links to that, and I invite you all to review our New Deal and just really dive into it, because I think that you all will be really connected to some of the transformative efforts and recommendations that are in there by young people and people who are closely connected to the work. I don't think there will be huge differences in what we're trying to do to push. And again, it's a huge roadmap, a clear roadmap towards transformation and what young people are saying we need. It's back to what Dr. Hayes Brown said about really investing in the people that are experiencing this and putting them in a position closest to the decision making and in those roles so that we can actually change what's going on. I know that you are all familiar with the Housing First model, and the Housing First model, like the New Deal, pushes personal choice around housing and resources, as well as the removal of barriers that hinder people from accessing housing and resources created for them, which I think is really important to hone in on, is really just that personal choice. Because people know what they need. It's just being able to access that and all of those barriers being omitted so they can actually access those things. I know young people and other people experiencing homelessness alike are best suited to create the solutions that solve for what they're experiencing. And so we just need to invest in that. Some of the emerging threats are really important, and I'm going to talk a little bit about those. But having efforts like the New Deal to end youth homelessness, Housing First, and all the other aligned efforts is salient to shifting systems into transformation and the liberation of people, which we all need to be working to do. As I'm sure you all know, there are several huge threats facing the youth we work for, as well as the populations you all work for that are outside of the youth population. And one of the emergent threats to young people experiencing homelessness is the criminalization of homelessness, which is really trifling. I'm not even going to front. Like the fact that you criminalize people not having a house, a place to stay, and think that putting them in prisons or in jail is like the way out is like really inhumane. And it really speaks to our disconnect as a society and as individual people to other humans and really empathy and care for other people. So if we can move to the next slide, I do want to highlight in reference some of the other ongoing threats, because while we are highlighting the criminalization of homelessness, youth, and poverty, I also want to identify some of the things that continue to be an issue as well. One being denying the reality of youth homelessness. I think so often in homelessness, young people are an afterthought because of all the other systems that are geared toward supporting them. But we forget that there is so many intersectionalities within us, the people that are experiencing homelessness, and those intersectionalities are where young people are falling through the gaps of the system. And so if we continue to deny that reality, then we're not going to be able to actually figure out a solution for that. Also, deeply rooted and embedded paternalism, this idea that because I'm an adult, I know what's best for you, that is out of pocket and it cannot continue to happen. We know that young people are some of the hugest leaders in this work. Hello. And we need to make sure that there is space for them and continue to shift power to young people with lived expertise, as well as other people with lived expertise. We know that there is a deeply rooted structural racism in every system, and we can't continue to try to fight a problem without acknowledging the root causes. So we need to do that. And we also know that COVID and other infectious diseases have really impacted what people experiencing homelessness continue to experience, and it really continues to exacerbate. And also the negative narratives that dehumanize, devalue, and blame people. We know that the Cicero Institute calling for a criminalization of street homelessness is not okay. We know that largely impacts young people experiencing homelessness by continuing to steal their voice, choice, and autonomy. This threat is forcing young people into jails before their lives are even able to start, and that's unacceptable. As Jeff and Dr. Hayes Brown mentioned earlier, this is a human issue. It's not a political issue, and people with lived expertise do need to be at the forefront of the decision-making and solution building. And I can tell you, as someone who experienced homelessness, when I was experiencing homelessness, I was like, dang, let me do some research. I could figure out if I'm a Republican or if I'm a Democrat. I was really out there struggling, like many of other people, young people, and people experiencing homelessness do. We don't have the luxury of being able to make decisions and vote for people that impact our way of life. And so I think that it's so important to understand that and to be able to help position those people so that they can be, again, at the forefront of the decision-making and solution building. I want to talk a little bit about the end state that we want to see. If we can go to the next slide, I'd appreciate that. Thank you. I know this is wordy, but I'm talking to a lot of well-educated and very passionate people, so bear with me. But this is the end state that we want to see, and this is directly from our New Deal to End Youth Homelessness. And I hope that aside from all the other things that I've mentioned, that this is something that makes you want to go and dig deep into the New Deal to End Youth Homelessness, and also get connected with us in partnership. But the first end state that I want to mention, what we want to see moving forward, is the freedom and civil liberties of all people, including people that experience homelessness, young people, people living in poverty, and that they're respected and protected by law and policy as individual rights, as are the individual rights to security, privacy, and dignity, regardless of their living situation. I just want to really hit the dignity, like, as something that's so important. The next end state that we want to see is that communities have full control over resources and institutions responsible for supporting the housing, well-being, and education needs of youth and young adults in order to create and nurture safety and security as defined by members of the community. These mechanisms or systems of safety are designed and managed by members of the community, inclusive of young people of all ages. And then the last one is that no person is excluded from housing, no matter their past system involvement, including any history of evictions, criminal history, and bad credit, and community defined safety of transformative justice processes and mechanisms that exist to support all members of the community. So that's the end state that we really, really want to see. And I know looking at this is like, all right, well, how do we do this? So I want to talk a little bit on the next slide about how you do this. First, before I dive into that, I want you all to take this personal, like just straight up, everything that you've heard here, take that personal and partner with all of us to get to that end state of what I just mentioned and make that a reality for the people that we serve. So how to pursue the transformative vision: continue to invest in and advocate for personal choice and autonomy of the people that we serve through the efforts of the New Deal. So partner with us around the New Deal, and also continue to invest in housing first, and authentically challenge ourselves, because we know in this work, our job is never done. We need to always be at the drawing board and make sure that we're thinking about ways to continue to progress to support people. And again, partnering with young people with lived expertise and other folks with lived expertise. Also joining the National Housing Law Center's Housing No Cuffs campaign and the Services Not Sweeps Coalition, and efforts to advance human rights and housing services, as well as those to end criminalization of homelessness. And then the last one, joining alongside us in commitment as a member of the National Coalition on Housing Justice to use our platform and resources to dismantle racist institutions and to advance just policies and amplify Black voices and solutions. It doesn't end here, and that's why I want to continue to invite you all to work with us and partner with us to get to that end state. In the chat, I put our link to our website and to our New Deal, and I put my email in there as well for folks that are really serious about partnering with folks at the national level, if you're doing state and local work, and if you are at the national level, also partnering with us. And I just want to say thank you to you all. Please don't hesitate to dive into our stuff and learn more about us and partner with us.
Marcella, thank you so much for your presentation. I was wondering if you could just take there's a lot of questions in the Q&A about criminalization, about how, what different methods we can use to combat criminalization. And I was wondering, for young people, what are young people telling you that they're seeing, and what's most important to the young people that you talk to around your transformative vision and criminalization in particular?
Yeah, young people really want the criminalization to stop. And I think from their perspective, it's like people misunderstanding how young people got there. And it's coming from the direct systems that young people are in that are supposed to help them. They continue to fall through that. And this lack of like connection with different systems, the way that they continue to be siloed and not work together is what's contributing to that. So I think just a lot of blindness around those pieces, and not really seeing what young people are experiencing as, you know, it's like passive collusion where I'm like, somebody else is handling that. So I don't really have to, you know, get into that, and really not giving young people a voice. Like, it's like that, back to that paternalism. I think I know what's best for you. And we know that those systems that are youth serving, they think they know what's best, but young people are still continuing to fall into the cracks. And ultimately, because there are people that think, well, you know, we've got to criminalize these people. They don't understand, again, that's another crack that young people are falling into, because a lot of them have gotten into homelessness by no fault of their own. And so now, you know, that's the end result. So I think I can give you a million ways on how we could fix this. But yes, I'm grateful that someone went back to my slide there. But I think those are a few ways that people can get connected and start to think more thoroughly through how we can combat that issue of criminalization for of young people.
Fantastic. Thank you so much, Marcella. You're also getting, you know, quite a bit of love in the Q&A. So I just wanted to point that out.
That's what's up. I appreciate that.
So to wrap us up today, I'm going to bring Sarah Sadian up, and she's going to close us out and tell you all about what kind of action you can take. Thank you so much from my perch over here at the National Alliance for joining us today. Sarah?
Great, thanks, Anne. So over the course of our 4 webinars that we've had in this series, you've heard from experts at the local level, the state level, the national level, who have all shared key information that you'll need to engage with your elected officials. We heard from folks who are experts in Housing First about how it combines housing and services to address homelessness. We learned about how homelessness is really a housing problem, and that as our housing crisis grows, we see more people pushed into homelessness. We spoke about long-term solutions, from universal rental assistance to building more housing supply to renter protections and more. We learned from programs in Houston and Abilene and other places across the country who are successfully ending homelessness, and ways that we can copy that in other places. We've learned from people with lived experience and others in Arizona, Missouri, Georgia, Washington, D.C. about the harmful and dehumanizing efforts that are gaining traction across the country, including efforts to criminalize homelessness and why these efforts are harming people of color, veterans, youth, and others. And so now we hope you're equipped to share this information with your elected officials and to talk with them about the solutions that are needed. To help you do that, we've put together a toolkit, which we will share with everybody in the follow-up email after the webinar, that has a lot of resources that you can be using. Next slide. So in the toolkit, it includes ideas for ways that you can engage your elected officials. You can schedule meetings, you can use social media, you can invite them to take a tour of an affordable housing development or a Housing First program. Next slide. We also have key talking points. How can you talk to your members of Congress? How can you talk to your elected officials about why homelessness is increasing and what the solutions are? Next slide. The toolkit also includes important resources about why that you can use about the housing needs in your state and district. You can use fact sheets that we've put together on Housing First, and even some talking points that directly go to the Cicero legislation that we've talked about on this and previous webinars as well. Next slide. But I want to talk to you a little bit about some of the immediate opportunities for you to be engaging on housing issues. In our toolkit, we talk about how we can be encouraging Congress to provide the highest level of funding possible this fiscal year, and especially to provide enough resources to expand housing vouchers to as many households as we can, and to fully fund homelessness programs. Now is really the best time for your advocacy. This week, Congress is passing what's called a continuing resolution that will keep the government open through December 16th. But at that time, they're going to need to pass a final spending bill. So we have a couple of months on our horizon, but we've already know that negotiations are ongoing right now about how to divvy up funding amongst housing programs and between HUD and other agencies. So now is really the best time for you to be engaging with your members of Congress and talking to them about the need for these resources You can also sign on to our national letter and share that letter with your colleagues and networks so that more people are signing on in support of housing resources. Next slide. We are also, there's a second opportunity that we have this year to expand resources, and that's with a tax bill that we expect Congress to pass at the end of the year. What I think is most important is that this is an opportunity for Congress to not only expand the low-income housing tax credit, but to reform it so that it better serves people who are experiencing homelessness or at risk of homelessness. Many of you may know that this tax credit is the primary source of financing for affordable housing, but on its own, it's often not enough to serve the households that we're all focused on today. We really need reforms to make sure that it's better reaching people who have the very greatest needs. And so, wait, keep back to the slide, yeah. So in an end of the year tax bill, we're hoping to pass things like expanding the incentives that are in place for developers so that at least 20% of the units in an affordable housing development are set aside and affordable to people with extremely low incomes. We want at least 8%, maybe higher, of all LIHTC resources to be set aside for people at risk of homelessness or experiencing homelessness. And we want to create new tools to help incentivize developments in tribal lands and rural communities that face additional challenges in building housing. We're going to add this to our toolkit. It's not in there just yet, but it will be there soon. But you can, in the meantime, check out the full list of needed reforms that we're pushing for, and you can use that to talk to your members of Congress about what's possible. I just want to thank everybody for joining our webinars, these last 4 webinars that we've had. It's incredible. We had 7,200 people register for today's webinar. It shows just an enormous amount of interest in the topic. And so, as Anne mentioned at the top of the call, we're launching monthly webinars on homelessness and housing first, so we can continue this conversation. That's going to start on December 12th. Be sure to stay tuned for more details. We hope to see you on the future webinars, and we'd love to hear from you about your experiences with these webinars that we've had so far and with ideas for the future. After this call, we're going to share a follow-up email with all of the resources, all of the presentations, the materials that we've talked about on this webinar and previous ones. But we also want to get feedback from you about how we can improve, what sort of information would be most helpful for you in your advocacy. So with that, I'm going to sign off. I thank everybody for joining today, and we look forward to being in conversation with you in the coming weeks and months. Thanks, everybody.